Assalamu alaikum. Today, my video lecture is on the gross anatomy of the liver. Now, we all know that this is a very important gland which performs multiple functions in the human body. So, today's learning objectives regarding the gross anatomy of the liver are that at the end of this session, you should be able to describe the location, lobes, shapes, surfaces, relations, coverings, and ligaments of the liver. Also, the dual blood supply, its lymph drainage, and nerve supply. In the end, we'll be talking a little about the clinical aspects, especially the concept of hepatic lobectomies and segmentectomy with anatomical reasoning. Also, I'll be discussing the preferred site of liver biopsy and then justify this preference with anatomical reasoning. So these are our objectives for today. Starting with the key points about the liver, we know that this is the largest of the abdominal viscera. Also, it is a wedge-shaped organ and it weighs about 1,500 grams. Keep in mind about the liver that it increases in size during childhood up to 18 years of age when a plateau is reached. Then after middle age, it declines steadily. The size of the liver also depends on the sex and body size. We know that the liver is a hematopoietic organ and this function is performed only in fetal life. So at that time, it is about 5% of the body weight. But during the infancy and then throughout life after birth, the liver drops this function of hemopoiesis, meaning it doesn't form the blood cells, but it has many other important functions in the human body. It is involved in the metabolism of carbohydrates, fats, and proteins. Also, it produces bile, which is necessary for the emulsification of fat. And it is also involved in detoxification of many harmful substances. Now, moving to the anatomy of the liver, which we are going to talk about, let's first discuss the location and position of the liver. The liver occupies the right upper quadrant of the abdomen. Now, this area is the right hypochondrium, the epigastrium, and on the left side, it extends into the left hypochondrium. Now, let's look over here at the location of the liver. So this is the diagram, and we're going to look at the surface anatomy of the liver. So if you could follow this red laser pointer, you can see that I am pointing towards the upper margin of the liver. And this upper margin is at the level of this here xiphisternal joint. And on the left, it reaches the fifth intercostal space. This here is the fifth intercostal space. And this is about 7 to 8 centimeters from the midline. Now let's look at the right side where the upper margin reaches the fifth rib and then it curves to the right border, which extends from the ribs 7 to 11 in the mid-axillary line. Then the inferior margin of the liver, this here is a line which is joining this left upper and the right lower extremities. And the central part of the inferior border is about a hand's breadth below the xiphisternal joint. So this marks the boundaries of the liver. And these arrows over here in the dotted lines are showing that the liver moves with the excursions of the diaphragm. And regarding the areas, we know that the region of the abdomen is divided into 9 anatomical areas. And over here, this here is the right hypochondrium. We can see the liver is mostly present in the right hypochondrium. Then in the middle part, which is the epigastrium, and its left tip is extending into the left hypochondrium. So these are the anatomical areas which are occupied by the liver. Now let's talk about the surfaces of the liver. So the liver is described as having a right surface, an anterior surface, and a superior surface, a posterior surface, and an inferior surface. Now, these are the 5 surfaces of the liver, but these surfaces can be collectively grouped into 2 main surfaces. One is the diaphragmatic, which includes the right anterior and superior surfaces. And the second one is the visceral surface, which includes posterior and inferior surfaces. So we can simplify the surfaces of the liver into these 2 main surfaces, one of which is the diaphragmatic surface, and then the other one, which is the visceral surface. So here are the diagrams from Gray's Anatomy, and they are showing the liver in different views so we can appreciate all the surfaces. Here in the diagram A is the superior view of the liver, and you can see obviously this here area shaded in pink is the superior surface of the liver. Now let's look at over here C, which is the anterior view, in which you can see the superior surface of the liver, a part of that, and of course the anterior surface, and on the right side you can see the right surface. So these 3 surfaces are visible in the anterior view: superior, anterior, and right. And as I mentioned before, collectively this surface is known as the diaphragmatic surface of the liver. Now let's look at the posterior view of the liver over here, which is, you can see B in diagram B, and this area which has been colored in brown represents the posterior surface of the liver. And just beneath that is the inferior surface. And if we look at it from inferiorly, the inferior view shows us the inferior surface of the liver. Now, like I mentioned before, the inferior and the posterior surfaces, they're collectively known as postero-inferior or visceral surface. So these surfaces are the surfaces which do not have very distinct boundaries. Okay, and another landmark which I'm going to mention over here, and then we'll talk about it later in some detail. So let's look over here at this area, which is on the inferior surface. I'm going to draw an H on the inferior surface of the liver. This limb of the H represents the ligamentum teres fissure and the fissure for ligamentum venosum. We will be talking about them in detail in the further slides, but right now I just want to highlight this area so we can understand the anatomy of the liver. So this is a line which runs on the fissures for ligamentum teres and venosum. And then there is a line, an arbitrary line, obviously, this is an imaginary line, which can be drawn connecting the inferior vena cava and the gallbladder, the fossa of the gallbladder. This here in green is the gallbladder lying in a fossa on the undersurface of the liver. So here is a line connecting it to the inferior vena cava. Now, between these 2 vertical lines, if I would draw a horizontal line connecting these 2 vertical lines, then I get an H. This horizontal line passes through the hilum of the liver, also known as Porta Hepatis. So this is an H, and remember, this H is a landmark on the visceral surface of the liver. And if you understand this landmark, then the anatomy of the liver can be very easily understood and a concept can be developed. Okay, so the basic concept is this H-shaped pattern on the visceral surface, where the crosspiece of the H is the Porta Hepatis, the right limb is formed by inferior vena cava and gallbladder, and the left limb is formed by the fissures for ligamentum venosum and teres. So this is just what I drew for you on the inferior view of the liver. Here are the diagrams representing this concept. When we look at the liver from the visceral surface, we can see the larger lobe is the right lobe. The smaller lobe of the liver is the left lobe. This is tapering, and this is obviously smaller in comparison to this larger right lobe. And here is the H. So the right limb, you can see of the H is over here, and this is the crosspiece of the H, and then we have the left limb of the H in the left sagittal or umbilical fissure. Okay, so why is this known as the umbilical fissure? Because this is representing the fissures for ligamentum teres and venosum, and the ligamentum venosum represents the ductus venosus, and so you can see over here in the next diagram, here is the ligamentum venosum, which represents the ductus venosus. If you recall the lectures of embryology, the ductus venosus was a venous channel that is functional during fetal life, and it transports blood from the umbilical vein to the inferior vena cava in fetal life. But after birth, it is closed and it is replaced by the ligamentum venosum. Also, we can see over here is the fissure for ligamentum teres, also known as the round ligament of the liver. This is the remnant of the umbilical vein. So collectively, this is known as the umbilical fissure. It forms the left vertical part of the H. And the right vertical part of the H is formed by the imaginary line passing from inferior vena cava to the gallbladder. And here the cross piece of the H is the Porta Hepatis. And these are the important landmarks on the visceral surface of the liver. Okay, let's talk about the relations of the liver. While discussing the relations of the liver, we can simplify them if we first consider the structures which are forming the liver bed. The liver bed consists of those structures, those anatomical structures which are present on the posterior aspect of the liver. Now, while mentioning this, I would like to clarify that as we know, the liver is lying within the peritoneum, so it is ensheathed by the visceral layer of peritoneum, but this visceral layer does not cover it entirely. There are certain parts of the liver where this visceral lining of peritoneum is absent. So here we can see this area shaded in green represents the outline of the liver, and the structures which are lying behind it are visible. This area where the green shade is not present represents the part of the liver where the visceral layer of peritoneum is absent. This is also known as the bare area of the liver. And on the medial aspect of the bare area, the bare area includes the inferior vena cava. Also on the posterior aspect of liver, we can see this here is the esophagus, and we can see the upper part, that is the fundus of the stomach. Of course, the diaphragm is also present behind the liver, and we know that the shape of the lobes of the liver is due to the sculpting of the diaphragm, because this organ is present partially under cover of the diaphragm. Posterior to the liver, including the structures forming the liver bed, we also have this here right suprarenal gland, the right kidney, and the right colic flexure, also known as the hepatic flexure. So we can now summarize all these anatomical structures which are present posterior to the liver forming the liver bed. Diaphragm, the right kidney and suprarenal, hepatic flexure of colon. Also, we have the gallbladders, duodenum, inferior vena cava, the esophagus, and the fundus of the stomach. Anteriorly, the diaphragm is also present, as well as the right and left costal margins, the right and left pleura and lower margins of both lungs, the xiphoid process, and also the anterior abdominal wall in the subcostal angle. Okay, so now I'm going to discuss the liver anatomy on a prosected specimen. And over here, you can see that this is the liver as it is present within the body, and the original location of the liver within the body is shown over here. And we can see this is the gland, the liver. Here, if you just follow the arrowhead, I'm showing you the larger right lobe of the liver, and then on the left, the smaller left lobe of the liver. And between these lobes, you can see a ligament is attached on the anterior surface of the liver. This is known as the falciform ligament. The lower edge of this ligament over here, now it is known as the ligamentum teres hepatis. This ligament, falciform ligament, attaches the liver to the anterior abdominal wall. Number 1 over here is representing the diaphragm. A part of it has been removed to show us the liver. And number 5 over here is showing us the lungs. So this here is the pericardial fat, and next to the left lobe of the liver is the stomach. And below you can see this is the colon, and here of course number 3 is the gallbladder. So if we were to lift this liver upwards in the direction of these two arrows, and then we want to observe the structures which can be appreciated, then this is the appearance of the liver from below and behind. Now, over here, as the liver has been lifted upwards, keep this in mind that this here is the anterior aspect of the liver. So just to keep that in mind, and I'm going to draw a very simple compass, which is showing that this here is the anterior side, and over here is the posterior side, whereas this here is the left, and over here is right side. Okay, now let's come back over here to the liver. So we are looking at the liver, and we can see that this side is the anterior aspect. We can see the gallbladder, which is lying in a shallow fossa on the undersurface of the liver. Here is the large, prominent right lobe, and the lesser prominent left lobe. And over here in the middle is the Porta Hepatis, or the hilum of the liver. So let's look for that landmark H, which we were talking about, because that makes it easier for us to understand. So I'm going to go back to the landmark and draw it over here on the visceral surface of the liver. So we are looking at the visceral surface of the liver. And like I said, the H is formed by a line which is passing from here, number 17 is showing us the round ligament of the liver. So a line passing from the fissure for the round ligament of the liver to the fissure for this over here, number 16, which is ligamentum venosum. We've drawn imaginary line, we've drawn one vertical limb of the H. Now the second vertical limb passes through the fossa for the gallbladder and then the inferior vena cava. So number 13 is actually the inferior vena cava. You can see, you can follow it over here. This here is the inferior vena cava. So now we've got the two vertical limbs of the H, and then of course the cross piece which passes through Porta Hepatis. So this here is the H. And as I told you before, this here is the H which helps us identify the liver anatomy, because here you can see this is one limb, and between this limb and the vertical limb passing through the gallbladder, over here labeled number 21 is the quadrate lobe of the liver. Whereas if you look at the posterior aspect between the two vertical limbs, labeled number 2 is the caudate lobe of the liver. The caudate lobe of the liver has this process labeled number 3, which is known as the caudate process. Okay. Also, you can see that within the Porta Hepatis are visible the portal vein, the hepatic artery, and the bile duct. These are the 3 important anatomical structures which are present in the Porta Hepatis. An important point that I would like to mention over here is that whenever we are talking about the liver anatomy, we should also keep in mind the division of the liver into lobes. Now, when we're talking about that, remember that these 2 lobes which I just showed you, the caudate and quadrate lobes, anatomically they're considered to be parts of the right lobe, but functionally speaking, they belong to the left lobe. This is because they receive blood from the left branches of the hepatic artery and portal vein, and they drain bile into the left hepatic duct. So functionally speaking, the caudate and quadrate lobes, they are present within the left lobe. Also, I would like to show you over here, number 12, it is showing the site of attachment of the coronary ligament. We will be talking about in detail later, but let's just look at where it is attached. And on the right side, it extends into the right triangular ligament on the right lobe, which is labeled 25. Whereas on the left side, it forms this here labeled 15 left triangular ligament on the left lobe. Okay, so these were the structures which were visible in the prosected specimen, just to get a better view. Now let's come back to our PowerPoint slides. And now let's talk about the peritoneal attachments, the ligaments of the liver. So we have over here, if we want to summarize the ligaments of the liver, the first one is falciform ligament. Falciform ligament, when we talk about this ligament, it's a two-layered fold of peritoneum that attaches the liver to the anterior abdominal wall, as I mentioned before. Now keep in mind that on the superior surface of the liver, this falciform ligament divides into the right and left layers. The right layer forms the superior layer of the coronary ligament, while the left layer forms the anterior layer of the left triangular ligament. And the round ligament, which is ligamentum teres, it runs in the lower free edge of the falciform ligament. It represents the obliterated umbilical vein, and it continues into a fissure on the visceral surface of the liver. Now, the coronary ligament, it has two layers, superior and inferior, and they enclose that area of the liver, which is the bare area. It is the area which is not lined by visceral layer of peritoneum, but in fact rests directly on the diaphragm and the right suprarenal gland. So the superior inferior layers of coronary ligament, they extend and meet on the right lobe of the liver to form the right triangular ligament, whereas on the left lobe, they become closely applied to form the left triangular ligament. The gallbladder, as I showed you, lies in a shallow fossa in the visceral surface of the liver, and the fundus of the gallbladder projects slightly below the inferior border of the liver. Remember, the diaphragmatic surface of the liver is covered with visceral peritoneum except the bare area of the liver and, of course, the inferior vena cava, which also lies within this bare area. And the visceral surface of the liver is also covered with visceral peritoneum except in the fossa of the gallbladder and the porta hepatis. So just keep in mind these exceptions. Then the ligamentum venosum. This represents the obliterated ductus venosus, as I showed you before, and it is also attached to the left branch of the portal vein. It ascends in a fissure on the visceral surface of the liver. Now let's talk about lesser omentum. Now, what about the lesser omentum? Lesser omentum is a fold of peritoneum that extends from the lesser curvature of the stomach and the proximal duodenum to an L-shaped attachment on the inferior surface of the liver. Now, attachment of lesser omentum is in the form of an L on the inferior surface of liver. The vertical component of this L runs in a fissure for ligamentum venosum, and the horizontal component of the L is attached to the edges of the Porta Hepatis. Okay, so I'm going to show you this attachment of the lesser omentum in the prosected specimen so we can just understand this point. Here is the visceral view of the liver, the visceral surface view, and over here is the Porta Hepatis, right? The hilum of the liver. Number 23 is representing the lesser omentum. And as you can see, it is attached to the edges of the Porta Hepatis, and also it extends into the fissure for ligamentum venosum. So how does this make an L? Okay, so let's see how this becomes an L-shaped structure. This here part of attachment to Porta Hepatis forms the horizontal part of the L, and the vertical part of the L is this here attachment to the fissure for ligamentum venosum. So this here is representing the L-shaped attachment of lesser omentum on the visceral surface of the liver. Okay, so let's go back to our presentation on the PowerPoint slides. The lesser omentum extends, you can see, from the liver to the duodenum. That part which is extending between Porta Hepatis and duodenum is called hepatoduodenal ligament. This encloses the structures that pass through Porta Hepatis, and it forms the anterior boundary of the epiploic foramen, which is an important anatomical landmark. The remainder of the lesser omentum, which is attached to the stomach, is now known as the hepatogastric ligament. So let's look at this ligament over here, the lesser omentum. Let's focus on its attachments on the liver as well as the stomach. So over here, this here is the liver, and this is the attachment of the lesser omentum. And you can see that here it is attached to the proximal part of the duodenum and the lesser curvature of the stomach. So this portion of the lesser omentum that is attached to the duodenum is known as the hepatoduodenal ligament, okay? And this part over here, which is attached to the stomach, is known as the hepatogastric ligament. So these hepatogastric and hepatoduodenal ligaments can be collectively called the lesser omentum. Okay, so this describes the attachment of the lesser omentum. Okay, Porta Hepatis is liver hilum. Porta Hepatis is a deep fissure on the visceral surface. Also keep in mind that the Porta Hepatis, you could say, is lying between the quadrate and the caudate lobes. So in front of the Porta Hepatis, or anterior to it, is the quadrate lobe, whereas posterior to it is the caudate lobe. And the contents, as I mentioned before, are portal vein, also the right and left branches of hepatic artery, right and left bile ducts. In addition to that, also lymph nodes and vessels are present here, as well as the sympathetic and parasympathetic nerve fibers. There is a specific arrangement of these structures within Porta Hepatis. We can remember that with this mnemonic VAD from posterior to anterior. So V means the portal vein, and then A is the hepatic artery, and D is the hepatic or bile duct. So the vein lies most posterior, the portal vein lies most posterior in the liver hilum, and most anterior is the duct, and between them is the artery. So this is the arrangement of structures within the Porta Hepatis. Also remember that all the structures in Porta Hepatis are wrapped within a hepatobiliary fibrous capsule of Glisson, which is also continuous with the fibrous hepatic capsule. Okay, so now that we have discussed the surfaces, the relations of the liver, let's highlight the key points when we're talking about the lobes of the liver. Now, as I mentioned before, the lobes of the liver can be either anatomical lobes or physiological lobes. If we talk about anatomical lobes, there is a larger right and a smaller left lobe, and this is on the basis of an arbitrary line of attachment which passes through the falciform ligament anteriorly and fissures for ligamentum teres and venosum posteriorly and inferiorly. And according to this division, the quadrate and quad lobes are considered to be a part of the right lobe of the liver. The quadrate lobe can be defined as the area which is between the gallbladder and fissure for ligamentum teres hepatis, whereas caudate lobe can be defined as the area or part of the liver which is between inferior vena cava and fissure for ligamentum venosum. If we look at the physiological lobes of the liver, like I said, this arrangement is based on vascular and biliary channels, and here the arbitrary line passes through the center of the bed of the gallbladder and groove for inferior vena cava. And the middle hepatic vein also lies in this plane. According to this division, quadrate and quadrate lobes are part of the left lobe of the liver. Okay, so now that we have just talked about the lobes, I would like to share with you the model, the digital model of the liver, and we can easily see over here in this model right in front of you that this is the anterior view of the liver, and if you follow the pointer over here, this here is the anterior surface, then the superior surface, and this here is the right surface. Collectively, as I mentioned before, these three surfaces are known as the diaphragmatic surface of the liver. Anteriorly, we can see this here is the falciform ligament, its lower free edge known as the ligamentum teres hepatis, or the round ligament. And this divides the liver into the larger right lobe and the smaller left lobe. If we follow the falciform ligament onto the superior surface, we can see that it splits into two layers. On the left lobe, this is the anterior layer of the left triangular ligament, whereas on the right side, you can see it forms the superior layer of the coronary ligament. Okay, so let's just look at this liver now from the superior and posterior aspects. We have turned it around, and now we can see if we follow the superior layer of coronary ligament, here is the inferior layer of coronary ligament now visible on the visceral surface. This here is now the visceral surface of the liver, which is representing posterior and inferior surfaces of the liver. As I told you, collectively it's known as the visceral surface. So here are the superior and inferior layers of coronary ligament, which are extended on the right side to meet distally as the right triangular ligament. Now, between these two layers, you can see this is a part of the liver which is known as the bare area of the liver. In this model, you can see that this is the part of the liver which is not so shiny, because the shiny or glossy area that is representing the attachment that is presenting the ensheathing or covering of the visceral peritoneum. But the bare area you can see is the non-shiny part. This is representing the area which is devoid of visceral peritoneum, and at the medial aspect of this area lies the inferior vena cava within the bare area of the liver. If we look at the anterior layer over here of the ligament, which is present on the left lobe, when on the left lobe, its extremity on the left, it forms the left triangular ligament where anterior and posterior layers are closely applied. This here is the left triangular ligament. Okay, now that we're looking at the visceral surface of the liver, we can see some impressions over here. So impressions on the surfaces of the liver are produced due to the anatomical structures which are closely applied to this gland. And so because this gland is a soft and pliable organ, certain impressions are going to be present. So if we look at the right lobe of the liver, then we can see that anteriorly is the colic impression due to the hepatic flexure of the colon, and behind that is the impression due to the kidney known as the renal impression. And similarly, on the left lobe, we can see the impression for the fundus of the stomach and also the esophageal impression. And we also look at the mental tuberosity, which is an elevated area on the undersurface of the left lobe of the liver. Here is the gallbladder, and we can see that this is the fundus of the gallbladder, and here is the neck region, and this area now is the Porta Hepatis or the hilum of the liver. So let's just zoom into the Porta Hepatis. We can see that posteriorly is the portal vein and anteriorly is the bile duct, and between these two are the right and left branches of the hepatic artery. So arrangement of structures in this Porta Hepatis are VAD, as I mentioned before, the mnemonic VAD from posterior to anterior direction. Okay, so this is the digital model of the liver, just to get a whole dimensional view of the liver of this gland. Okay, so let's now move back to our slides. Moving back to our presentation. Now that I've discussed the basic anatomy of the liver with you guys, now we'll talk about the clinical aspects, the functionally significant clinical aspects. For that, we are going to discuss now segmentation of the liver. So there are the surgical segments of the liver. These are more important clinically from a surgical point of view. And what the clinical importance is, we'll discuss that later. First, let's look at the segments. What do we mean by the surgical or hepatic segments? Before considering segments, we consider sectors. We can divide the liver into 4 main hepatic sectors, or simply sections. These are the left lateral, the left medial, the right lateral, and the right medial. So these are 4 sectors, and now these 4 sectors are further subdivided into 8 segments using Roman numerals. Here is a diagram showing us the 8 segments of the liver, which are the surgical segments. So before that, we have to consider the 4 main sectors. Now the sectors, as I told you, are, this here is the left lobe of the liver, and this here is the larger right lobe of the liver. The 4 sectors are, you can see, right medial, and right lateral. Right medial, right lateral, and over here in the left lobe, you have the left medial and the left lateral. So the 4 sectors, these are formed by, if you look over here in the right lobe, this here is the right hepatic vein, which is running in the right portal fissure. Because of this right portal fissure, the right lobe is divided into a right lateral and a right medial, these 2 main sectors. Whereas in case of the left lobe, we can see over here U represents the umbilical fissure. We talked about that before. The umbilical fissure is representing the fissures for the ligamentum venosum and ligamentum teres. This divides the left lobe into the left medial and the left lateral sectors. So now we've got these 4 sectors. These sectors are further subdivided by this T, which represents a transverse plane. This here transverse plane, you can see, is subdividing these sectors, these 2 sectors into 4 sectors now, okay? And the 2 upper ones and the 2 lower ones. Over here, we can see that the lateral left sector has been also divided into an upper and lower sector, right? And over here, if we count the segments now, because I said there are a total of 8 segments which are formed. So the first segment over here, you can see, is the caudate lobe. So remember, the caudate lobe is the first segment. And caudate lobe functions independently as a separate lobe of the liver because it has its own branches of hepatic artery and portal vein, and it is also sending its blood directly into the inferior vena cava. So remember, the caudate lobe functions as an independent lobe. Number 1, the first segment is the caudate lobe. Then you can see the second and the third, which are the upper and lower segments in the left lobe. And fourth is the quadrate lobe. Okay, the fourth one is the quadrate lobe. And then 5th and 6th, 7th and 8th. These are the segments present in the right lobe. So these are a total of 8 segments, 8 hepatic segments of the liver. If we look at the liver from below, if you're looking at the visceral surface of the liver, these segments are arranged in an anti-clockwise direction around the Porta Hepatis. So here is the Porta Hepatis in these segments 1, 2, 3, 4, 5, 6, 7. You can see they're arranged in an anti-clockwise direction. Now, what is the clinical significance of hepatic segments? The clinical significance is that it is possible to remove one lobe of the liver and even a particular segment, only a certain segment of the liver, which is known as lobectomy or the segmentectomy, respectively, with minimum bleeding, because the biliary and the vascular channels which are present between the sectors and segments, they do not communicate. So it facilitates the removal of a specific segment. But why would a surgeon want to remove a segment? It is required in cases where only one or few hepatic segments have been affected by trauma, injury, or by a tumor. Also keep in mind the hepatic veins, they are the guides to the planes between the hepatic divisions. Even though they are the guides, they also have to be saved and protected because they can provide the major source of bleeding which the surgeon must avoid. So if we look back at this diagram over here, you can see that here are the hepatic veins, the 3 main hepatic veins. You can see the right hepatic vein, this here is the middle, and this here is the left hepatic vein. So these are the 3 main veins of the liver, left, middle, and right. And the planes, they are running within the planes which are subdividing the liver into these sectors and segments. Okay, so regarding the clinical aspect, I also said I would like to mention the site of liver biopsy. But before coming to that, let's look at these 3 veins which I just mentioned in an ultrasound. In an ultrasonograph, you can see over here, these dotted lines are pointing towards the hepatic veins, which were right, left, and middle. So why are these hepatic veins visualized in an ultrasonograph? Even though we have described this general pattern of segmentation of the liver, keep in mind there are many variations. There are individual variations. So before performing surgery, it is necessary to visualize the patient's segmental pattern with ultrasonography and dye injection. So over here, you can see the hypoechoic or the darker or black areas which are representing the precise location of the hepatic veins. Blood supply of the liver. When we talk about the blood supply, remember the two sources of blood which is entering the liver. The first is the arterial supply, which is bringing oxygenated blood to the liver. This is representing 30% of the input. And this is represented by the hepatic artery, which is a branch of the celiac artery, and it divides into right and left branches in the Porta Hepatis, and then it gives off sectoral branches. The venous supply is also entering the liver through the portal vein, which is representing the 70% of the input, and this consists of the products of digestion from the gastrointestinal tract. The portal vein also divides into right and left branches within Porta Hepatis, which then in turn give rise to sectoral branches. Now the venous drainage, you can see the arterial and venous blood is conducted first to the central veins of the liver lobules by the liver sinusoids. And then the central veins will drain into the three hepatic veins, which I mentioned before, right, left, and middle, which eventually drain into the inferior vena cava. Remember this important point that when we talk about the hepatic artery and portal vein, there is no mixing of blood between the right and left halves of the liver. All the arteries which are entering the liver, they are end arteries. The venous return differs in that it shows a mixing of the right and left halves of the liver. Now, the liver is a gland which produces a large amount of lymph, and this lymph from the liver as well as the lymph from gallbladder is drained into hepatic nodes in Porta Hepatis. And then the efferents from the hepatic nodes go into the pyloric and celiac lymph nodes. Also keep in mind the lymph from the bare area of the liver passes through the diaphragm and goes into the posterior mediastinal lymph nodes. Nerve supply of the liver is by sympathetic nerves, which are derived from the celiac plexus, parasympathetic nerves, which are derived from the anterior vagal trunk, and these nerves enter Porta Hepatis via the lesser omentum. So now, as I mentioned, I want to tell you about the site for liver biopsy. This is performed when we want a sample of the hepatic tissue, and for getting that small sample for diagnostic purposes or investigative purposes, we use a biopsy needle, and this biopsy needle is inserted into the right 8th or 9th intercostal space in the mid-axillary line, over here in the mid-axillary line, with the patient holding their breath in full expiration, because that avoids damage to the lungs. So this is the site for taking a liver biopsy, where the liver tissue is removed and then it can be observed under a microscope. Okay, so this ends with today's topic discussion on the anatomy of the liver. And we discussed the relations, the surfaces, the lobes of the liver, the ligamentous attachments. And I tried to present this topic to you in a very simplified way, something that is easy to understand and easy to recall. And these were the books from where this topic was prepared. And I hope my using a model helped you. I hope showing the prosected specimen helped you in getting the image in your mind and understanding the basic anatomy of this vital gland. So if you like today's video lecture, could you please like and subscribe to my YouTube channel, which is AnatomyMentor. I will be sharing further lectures on gross anatomy of the important glands of the body. And you can also follow my lectures of embryology, neuroanatomy, and histology. And you can subscribe to my channel by simply pressing on my picture, which is going to appear at the end of this video. So thank you for your time, and hope so that I'll be seeing you again with more lectures. Take care, and Allah Hafiz.